Okay, so I want to cover a couple slides on our first lecture. So I want to talk about IV assessment. Please remember iTrace, okay? So anytime you have anything hooked up to your patient, you need to be going to the point of origin, following it back. So this is for IVs, but this is for anything, for oxygen, for nasogastric tubes, to flexi seals, to Foley catheters, anything that's attached to your patient, you should be starting at the point of origin and then following it back. So for anything that's hooked up to the IV, you want to take note of what's running, the medication, the flow rate. You're going to always check that against your MAR and your clinical paperwork, because things can be hung wrong and we need to be checking it. So you need to check what's running. You need to check it to the MR. You also want to be checking your tubing. So each facility has different protocols for their tubing. Please make sure you know the protocols for where you're assigned. Part of what the expectation for Professor Morales and myself is that when we walk in the room with you and we're giving IV meds, you've checked your tubing, you know if you need tubing, do you need a flush, do you need alcohol? Our expectation is that you're going to be gathering your supplies, and that's part of your critical thinking and clinical judgment. You're going to also want to make sure that your tubing is placed properly. It's not kinked. It's not pulling on anything, because that could be causing a challenge for the IV. You want to take a look at your drip chamber. You want to make sure that the drips are dropping in the proper drip chamber. You want to make sure that it's at least a quarter to halfway full. And once again, the label per policies. If you see when we're administering IV medication that the tip of the IV is not covered or it's contaminated, we either need to change out the line or clean that appropriately. We also need to know what the protocol is at the facilities for blood and lipids. Each facility is a little different, so please make sure you know what the protocol is at the facility. All right, so let's move down. So what you're looking at here this is extravasation. Extravasation is when there's tissue necrosis of an infiltrated IV, and the medication that has been administered is causing necrosis in the skin. Oftentimes medications such as vasopressors, certain IV fluid, and certain medications cause necrosis. So it's very important that we are assessing our lines in the morning and our shift. So you walk in and you're doing your head to toe assessment. You need to be assessing the line at that time, and you need to be assessing the lines before, during, and after we are infusing the medication. So ways that we're going to assess the site for infiltration, so signs and symptoms, is number one, we're going to look at the site. We're going to be looking for redness. We're going to be looking for swelling, bleeding, leaking of the IV. When we're flushing the line, you're going to be looking for pain. Okay, the patient says, ouch, when you're flushing it. Chances are it's infiltrated. It shouldn't hurt. Swelling, leaking, tenting of the skin. So those are things that we're looking at. New IVs, you should be able to pull back on your flush, aspirate a little bit of blood out to see if you have blood return. But if the IV's been in place for a number of days, that's not going to be the case. So things you need to be thinking about, you must be assessing these IVs. That is part of your student responsibilities at the bedside. All right, so let's move on. So some other pitfalls of IV therapy. So patient might have dyspnea, cough, pitting edema, things we're going to be looking for. Does this patient have a history of congestive heart failure, renal insufficiency? If that's the case, things that we might want to do if we were the primary nurse: decrease the rate of the IV, increase the head of the bed, dangle feet, frequent vitals, frequent auscultating for adventitious lung or breath sounds. And of course, we want to notify the MD. So signs and symptoms of an air embolism, that's if air somehow got into the patient's vasculature as a result of IV medication administration. Your patient might complain of chest pain, shoulder pain, shortness of breath, cyanosis, air hunger, hypotension, weak pulse, and changes of level of consciousness. This is an emergent situation. We would want to put the patient on their left side in a Trendelenburg position, notify MD, frequent vitals, and we always want to remain with the patient until they are stable. All right, so that's pretty much all I wanted to review on this slide, or on this for the rest of this PowerPoint. Please make sure that you look at the rest of these slides, and please bring any questions to class on Wednesday. All right, guys, thanks.